Pattern identification. When I first entered TCM school, I really couldn't adapt. They made us memorize the entire Mencius. I felt like I had enrolled in the wrong school. I kept thinking, should I quit school? But two subjects made me start enjoying studying TCM, Shanghan Lun and TCM pattern identification. Why were they so captivating? Because pattern identification was very logical and well structured, unlike many other subjects in TCM. However, after I graduated, completed hospital training which took 10 years, and got a job under a successful private TCM clinic director to learn more in an apprenticeship style, my perspective began to change. One of the first things I did there was design patient charts. I included the 8 principal pattern identification in the chart with the idea, let's not miss the big picture when seeing patients. But the director gave me a backhanded compliment, saying, yes, it's good to try this, work hard. I could tell it wasn't really praise. As I observed patients with him, I began to realize the flaws in pattern identification. That's why the director was so lukewarm. In a word, patients don't fit neatly into patterns. When a patient does fit, it's exciting. You might even find yourself telling them, you're a textbook liver-qi stagnation case. Thank you. Of course, the patient is left confused. But the reality is that most patients are far too complex to be boxed into a single predefined pattern. Sometimes, or rather quite often, you'll encounter patients who don't align with any textbook pattern. For instance, everything about their condition points to a heat pattern, but the patient insists they only prefer warm food and drinks. At that moment, it's tempting to say, you just don't realize it, but you probably prefer cold drinks. That would make sense. This reflects an urge to force patients into the predefined patterns we've memorized. But what is real? Is the textbook pattern identification real, or is the patient real? The patient is real. You may find yourself trying to force the reality of the patient into the theory of patterns. However, the theory of patterns is merely a tool to help explain the reality of the patient. So why does pattern identification face these challenges? Why does it often feel so inapplicable when working with actual patients? Does this mean the pattern identification system is completely wrong? The pattern identification system as we know it today was developed in the 1950s in China as part of an effort to make traditional Chinese medicine more systematic and aligned with the disease classification approach of Western medicine. As a result, it possesses logical and rational strengths but also creates challenges in clinical application. To address the infinite variety of pathological phenomena in patients, the system continues to generate more and more patterns in an attempt to explain them all. Despite the growing number of patterns in modern TCM textbooks, it remains impossible to fit every patient into one of these predefined categories. There are simply too many patterns, and yet they still fail to encompass the full complexity of real patients. However, it's important to note that the pattern identification system didn't invent something entirely new. Instead, it organized the various patterns mentioned in classical texts. In this sense, it doesn't lack authenticity. The real issue arises when this system is interpreted as akin to the Western medical disease classification model. Even in Western medicine, there is debate about disease classification as a framework for treatment. In the late 1980s, a paper titled Philosophy of Medicine made an insightful observation about disease classification. The author wrote, "The fact that the history of each disease classification is very short from a medical history perspective ironically highlights that the classification of individual patients is artificial. In order to establish medicine, similarities had to be emphasized rather than differences. Disease names can be considered as labels attached to groups of patients who resemble each other in aspects we consider important. In medicine, this idea is succinctly expressed by Rousseau's aphorism, 'There are no diseases, only sick people.' This means that diseases cannot fully explain patients. Patients cannot be reduced to a simplified disease classification system. Even in Western medicine, there is a critical perspective on such systems, yet we seem desperate to mold TCM into something resembling Western medicine. In TCM, there's no clear line where young deficiency ends and young excess begins. There's no threshold or standard range as in Western medical diagnostics. Excess and deficiency are determined only in relation to surrounding factors. There is no objective or absolute yang deficiency or excess. TCM's approach isn't about splitting and dividing to pinpoint a precise pattern. On the contrary, it's about expanding and broadening to comprehensively understand the real patient using the pattern system. So, does this mean pattern identification is inherently flawed? Not at all. After years of contemplation, seeing patients and facing challenges, I've come to realize that the issue lies in how we misunderstand pattern identification as a disease classification system. If properly understood, it's not a problematic system at all. In fact, it's a system that can be used rationally and effectively. So what is real and traditional pattern identification in TCM? Let's explore this together. What is pattern identification? Pattern identification is a foundational methodology in traditional Chinese medicine for diagnosing conditions and formulating treatment strategies. It involves understanding and categorizing the patient's symptoms into patterns that reflect the underlying imbalances in the body. The key concepts of pattern identification are Zheng, refers to the symptoms and signs that manifest in the patient. This includes both subjective experiences and objective findings. Bian refers to the process of identification or differentiation. It is the analytical step in which the practitioner organizes and interprets the symptoms and signs. Pattern identification combines Zheng and Bian to identify a pattern or an impression of the patient's condition. This process involves compiling and synthesizing the observed symptoms and signs into a coherent picture that reflects the underlying imbalance. Pattern identification is essentially about understanding the nature of an imbalance. This process is rooted in observing the overall picture, the dynamic interplay of all symptoms and signs, to form a comprehensive impression. TCM emphasizes recognizing the holistic landscape of a patient's condition to guide treatment. Pattern identification is not about finding diseases or causes. Pattern identification is not about diagnosing diseases or identifying their causes. The most common misconception is the belief that pattern identification involves naming the disease or pinpointing its cause. Many acupuncturists equate pattern names with Western medical disease names, treating them as such. Pattern names are just labels for clusters of similar symptoms. They represent groupings of symptoms, defined based on a pathological mechanism or pathophysiological model that organizes similar presentations. Thus, the names of pattern identifications are similar to the names of syndromes in Western medicine. A syndrome, too, is neither the name of a disease nor its cause. Rather, it describes the overall picture of a patient's condition. When we say liver-qi stagnation, it doesn't mean the patient is liver-qi stagnation. The patient's actual state is a blend of various factors. There might be a bit of spleen-qi deficiency, some food stagnation, a hint of stomach heat, athlete's foot on their big toe, and perhaps some qi deficiency from overexertion the previous day. Do you see? That's who the patient is, the person sitting in front of you. If you're still unsure, take a closer look at the formula you prescribed under the assumption of liver qi stagnation. Does it only include herbs to release liver qi? No, you'll find herbs that address various other imbalances and patterns. TCM practitioners must not regard pattern identification as equivalent to a disease name or a cause of disease. Many of us, immersed in modern scientific thinking, believe that treatment is impossible without knowing the disease's name or cause. However, in Chinese medicine, the cause of the disease is not what's most important. At this point, you might feel perplexed. Dr. Kepchuk explained about cause in TCM. In Chinese pattern thinking, what might at first seem to be a cause becomes part of the pattern, indistinguishable and inseparable from the effect. Pattern thinking subsumes the cause, defining it in terms of the effect and making it part of the total pattern. What we in the West call a cause has little importance in Chinese thought. For qi and its resonance operational system, the cause, the process, and the outcome merge. The lines of causality are bent into circles. The process of pattern identification is an integrative understanding. The key focus in pattern identification is the landscape, the overall impression of the patient's condition. This holistic picture is what truly matters. When multiple symptoms and signs come together to form a meaningful whole, this is called a pattern. It's similar to getting to know someone and identifying what kind of person they are based on their behaviors and tendencies. For example, imagine someone who consistently borrows money but never repays it, avoids group outings that require shared expenses, rarely shows up for others' important life events, but always expects gifts or attention for their own milestones. Over time, you might identify this as a self-centered or freeloader pattern. You might think that pattern identification is similar to personality types like those in the MBTI. Correct. Pattern identification is less about naming a disease and more about categorizing types in this way. In pattern identification, it is essential to observe the overall picture both from a broad perspective and up close, recognizing the relationships between individual elements and understanding the patterns as a whole, such as differentiating between constipation with fever and constipation with vomiting. Some elements may hold no particular significance on their own, but can take on a specific meaning when combined with certain other elements. This process is similar to looking at a painting and saying it's in the Impressionist style, the Surrealist style, or the Renaissance style. You can't pinpoint one exact element, but you talk about it after seeing the whole picture. In Western medicine, diagnosis means accurately identifying problems by breaking them down into small, independent parts. However, in AHM, looking at individual elements alone is meaningless. You must see the whole. Identifying imbalances within the whole constitutes the pattern identification of traditional Chinese medicine. Pattern names and diagnoses may seem similar, but they are completely different concepts. No pattern name describes 100% or even 70% of the patient's disease state. We can talk about pattern identification like this. When we look at a painting, we can sense a certain painter's style or painting style. For example, we might gaze at a painting and exclaim, "This screams Claude Monet." Similarly, while enjoying a novel piano composition, we could find ourselves wondering, "Doesn't this sound like Claude Debussy?" In this way, a style, a stereotypical pattern that has been frequently seen in the past, is what is called a pattern in TCM. Therefore, pattern names cannot represent the actual situation of the patient. It is just a label. We often find ourselves trying to fit the complex and intricate patterns of patients into a single definitive category. However, a patient's patterns cannot be confined to the 30 or 100 textbook patterns. Do not force real patients into the rigid framework of predefined textbook patterns. Pattern identification is merely a tool to help us understand the patient better, but the real patient is far more complex than predefined patterns. When examining a patient, it's important not to focus solely on isolated signs, such as concluding the pulse is rapid, so it's a heat pattern, or there are teeth marks, so it must be a spleen and kidney yang deficiency pattern. Instead, you must consider the entire picture. Evaluate whether the rapid pulse aligns with the other symptoms, and whether the teeth marks provide consistent information within the overall presentation. It's crucial to carefully examine the details and then step back to view the broader context. When you take in the full picture, you'll find that it is uncommon for all signs and symptoms to neatly fit into a single pattern. This mirrors the concept of yin and yang, where yang always accompanies yin and yin always accompanies yang. This interconnectedness highlights the importance of understanding mixed patterns. Mixture of different patterns. When diagnosing real patients, patterns such as cold, heat, excess, or deficiency rarely present themselves in a clear-cut manner. It can be quite challenging. One aspect may show signs of a cold pattern, while another suggests heat. This can often leave practitioners feeling frustrated. However, consider the yin-yang diagram. Yin always coexists with yang, and yang always coexists with yin. They are inseparable and continuously transform into one another. Because of this dynamic relationship, real patients cannot be neatly categorized into cold heat, excess deficiency, or interior-exterior. Instead, seemingly opposing patterns often coexist. First, there are cases where branch and root issues coexist due to the pathology's causal relationship. In these cases, excess and deficiency patterns often overlap. Second, different patterns may coexist in parallel. This typically occurs based on location, such as heat in the upper body and cold in the lower body, or heat in the stomach but cold in the large intestine. Third, the rarest situation is when one pattern is false. When yin or yang becomes extreme, the opposite quality may appear as a false presentation. 1. Branch versus root issue. Branch and root are mutually related. Main characteristics. Mixture of deficiency and excess, Hüsse, cause and consequence relationship, e.g. spleen deficiency, dampness, yin deficiency, empty heat. Treatment approach. Usually need to be treated simultaneously. Branch treatment. Remove dampness, phlegm. 2. Combined cold and heat, current and underlying symptoms coexist independently. The current symptoms and underlying conditions are two separate conditions that coexist without direct causal relationships. Main characteristics, mixture of underlying conditions and current symptoms, e.g. mouth ulcers, heat in a patient with chronic yang deficiency. Different symptoms in different locations, e.g. chronic diarrhea, intestinal cold, with an ankle sprain causing blood stasis. Treatment approach, priority-based approach, treat urgent conditions first, sen. Address important conditions first, dung. Simultaneous treatment when appropriate. 3. False heat, true cold, false cold, true heat. When a patient's pattern does not fit into the dichotomous categories of cold and heat, one of the patterns may be false. Main characteristics. False symptoms often appear in the face or limbs, yang areas. True symptoms are typically found in the trunk area. For example, extreme heat damaging yang may manifest as false cold symptoms, while extreme cold constraining yin may present as false heat. Treatment approach. Focus on treating the true condition. False heat or cold is a severe presentation that requires careful differentiation and attention to the underlying extreme yin or yang imbalance. Mixed patterns require practitioners to recognize the complexity of real-world cases, moving beyond textbook definitions to tailor treatments that address the full scope of a patient's condition. Practice. A patient who normally has weak physical strength, poor digestion and sensitivity to cold ate tteokbokki, spicy rice cake, and when their mouth felt burning hot, they ate a lot of papingsu, red bean shaved ice, as treatment, which resulted in diarrhea. Let's analyze the yin-yang imbalance and deficiency excess patterns in this patient's condition and explain why the treatment caused side effects. A patient who normally has weak physical strength, poor digestion and sensitivity to cold ate tteokbokki, and when their mouth felt burning hot, they ate a lot of bingsu as treatment, which resulted in diarrhea. Underlying symptoms: weak constitution, poor digestion, cold sensitivity. This indicates yang deficiency, spleen qi deficiency. Cause: eating spicy tteokbokki, created temporary heat condition. Current symptom: burning sensation in mouth. Burning sensation indicates temporary yang excess. Treatment and result. Treatment: cold patbingsu, cold dessert severely damaged already weak yang. Result: further compromised yang leading to diarrhea. This is not a branch versus root issue. Branch and root are both related mutually, but the current symptoms of this patient and original symptoms are two separate conditions. This is called combined cold and heat. The burning sensation was heat excess, which is urgent, while the constitution is cold and not urgent. It is only about priority. It must not be interpreted with root and branch or fake heat, true cold, which is a very serious condition. Depending on the situation, you can soothe thirst and oral burning sensation with lukewarm water. If the burning sensation is severe, you can quickly reduce heat with ice, patbingsu, for a short time. You can keep the body warm overall while exposing only the mouth to ice. For actual patient prescriptions, you can use mild heat-clearing herbs. Most commonly, you can use very strong heat-clearing formulas urgently and then monitor progress and adjust. You can use heat-clearing formulas locally for the stomach while simultaneously tonifying the fundamental yang energy, kidney.